Hi, my name is Brittany. I'm one of the student nurse practitioners today. I came to do a health history on you, so I'm going to ask you a series of questions about your personal history, your family history, your social history. So I'm going to go ahead and provide privacy, wash my hands. Can you state your name and date of birth?
Tina Jones, 6/13/1980.
Okay, so what brought you in today?
My knee's just really been hurting.
Okay, which knee?
My right one.
Right knee. Okay, when did that start?
About 2 weeks ago when I fell.
You fell. Okay, how'd you fall?
I tripped over the rug walking outside.
Okay, fell onto the knee.
Yes.
Okay. Is there anything that makes the pain better?
When I rest, I've taken some ibuprofen.
Okay, strength, frequency, how are you taking that?
Just the regular dose, like 1 every 6 hours.
Okay, so you are taking that. Is that helping?
Yeah.
Okay, so you said rest medication makes it better. Is there anything that makes it worse?
If I walk for a long time.
You walk for a long time. Okay. On a scale of 0 to 10, what would you rate your pain?
About a 5.
About a 5. Okay. So we already talked about medications. Are you taking any other medications?
No, ma'am.
Okay. Any over-the-counter medications, herbal medications?
No, ma'am.
Okay. Are you allergic to anything, any medications, food, seasonal allergies, anything like that?
No, ma'am.
Okay. And were you ever diagnosed with a major adult illness such as diabetes, COPD, anything like that?
No, ma'am.
Okay. Were you ever diagnosed with any major illnesses as a child, such as like asthma, cystic fibrosis, anything like that?
I did have chicken pox when I was little.
Chicken pox, okay. Or shingles? Or have you had an outbreak of shingles?
No, ma'am.
Okay. Any surgeries? Have you had any surgeries?
No, ma'am.
Okay. Hospitalizations?
Just for my kids.
Okay. Blood transfusions?
No, ma'am.
Okay. So when was your last period?
About a month ago.
A month ago? Okay. When did you start when did you start your period?
When I was 12.
12? Okay. How would you describe your flow?
Normal. Usually for about 4 days, and then the 5th day light.
Okay. Any history of STDs? Are you sexually active?
I am with my husband. No history of any infections.
Okay. Do y'all use safe sex? Like condoms, birth control?
Not anymore.
Not anymore. Okay. So you said you have children. How many children do you have?
3.
Okay. How many pregnancies did you have?
3.
Okay. Full term, preterm?
Full term.
Okay. Did you have any issues with that birth?
Mom
or baby?
The first one, I had a few issues with mom and baby. And they almost had to do a blood transfusion, but they didn't. No issues with the others.
Okay. So you had some bleeding?
Yes.
Okay. So tell me about your mom, health history-wise. What do you know about your
mom? She died of breast cancer.
I'm sorry.
Thank you.
You hear that.
But they did do the genetic testing while she was still alive, and nothing turned up positive for me to have to go be seen.
Okay. Well, that's a plus. That's good. What about your dad?
My dad does have high blood pressure and high cholesterol.
Is he taking any medication for that?
I believe he does for both.
Okay. What about your maternal grandparents on your mom's side?
My maternal grandmother did have type 1 diabetes and a lot of heart issues. My maternal grandfather, no issues I know of.
Okay. What about your paternal grandparents on your dad's side?
My dad's dad died of a heart attack at a young age.
I'm sorry.
Thank you. I didn't know him.
Oh.
And then my dad's mom smoked tobacco, but other than that.
Okay. What about siblings? Do you have any siblings?
I do not.
Okay. Is your children, do they have any
were they major issues?
Okay, good. When was your last physical exam?
About 6 months ago.
Okay. Have you done any recent screenings, like a lipid panel? Have you done like pap smears or mammograms, colonoscopy?
I think they did 6 months ago, and everything was normal.
Okay. Do you do self-breast exams?
I do.
Every month. Okay. And immunizations? Did you get
Up to date.
up to date? So you're getting a yearly flu, COVID, that kind of stuff. Okay. Tell me about your diet.
Well, we're busy a lot,
Mm-hmm.
so we do have fast food a couple of times a week, but other than that, we try to eat relatively healthy. No fried foods. That's what we try to stay away from.
Okay, so tell me about home. Where do you live? Is it a hotel, a home? Who lives with you?
It's a single-story brick home,
Mhm.
just me, my husband, and our kids. I feel safe in our neighborhood.
Okay, neighborhood's quiet and peaceful as well. Okay, and you have food, water, shelter. You can afford your meds, can afford food.
Yes, ma'am.
Okay. So tell me, what do you do for work?
I'm a nurse.
You're a nurse. Okay, how long have you been a nurse?
10 years.
Okay, what type of background? Like, do you work in Catholic, ER?
I used to work in the neonatal ICU, and now I work with pediatrics in the school.
Okay, well that's good. Have you had any recent travel exposures to illnesses or anything?
I did recently travel to Canada. Haven't been sick, and we kept an eye on ticks while we were there, so I know I didn't get bit by any.
Okay. Financial situation. We already talked a little bit about. You can afford, you can afford your bills, you can afford your medicine, you can afford your food. Correct. Back to the home. Do you have guns in the home?
We do.
Are they put in the safe?
They are.
Okay. Do you have any military experience?
No.
Okay. What is your religion preference?
Christian.
Okay. What's your hobbies and interests?
Softball and baseball with my kids.
Okay. Who's your support group?
My husband's side of the family.
Okay. We already talked about safety. Do you wear seat belts, helmets, or anything like that when you drive?
We do wear seat belts. I do not do anything that requires a helmet.
Okay, good. Do you smoke? And that's going to be like e-cigarettes, cigarettes, vapes, dip tobacco, those pouches. Do you do any of that?
No, ma'am, not anymore.
Okay. So former. How long ago since you quit it?
12 or 13 years.
How long were you a smoker?
3 years.
Okay, but you said you did vape, correct?
Yes.
Okay, so how often did you vape?
Oh, I did it every day, but I don't do it anymore.
Okay. Do you drink alcohol? Okay. Do you do any illicit drugs? That's going to include marijuana, meth, anything like that?
Oh.
Okay. Tell me about your exercise routine.
Well, I get in the yard and practice softball and baseball with my kids. Other than that, I don't really exercise.
Okay. So are you experiencing any fatigue, lightheadedness, dizziness?
I'm tired all the time, so I think that's just from running circles with them.
Okay. Any vision issues? I see you wear glasses. Or any changes in your vision?
No.
Okay. Any hearing aids? Any recent hearing loss?
No.
Okay. And of course, no sinus congestion that you struggle with, or like any sinus drainage, normal allergies that you constantly get.
No, ma'am.
Okay. Any problems chewing or swallowing?
No, ma'am.
Okay. Do you have any issues with your muscles, like muscle pain, muscle fatigue?
No, ma'am.
Okay. No chest pain, shortness of breath?
No, ma'am.
Okay. No burning when you pee, frequent urination, nothing like that. Okay. Abdominal pain, nausea, vomiting, diarrhea?
No, ma'am.
Okay. Any rectal bleeding?
No, ma'am.
Okay. And nothing on your skin, no wounds, no bleed, or open areas of the skin, no bruising. You don't bruise easily.
Not that I've noticed.
Okay. Do you get excessively thirsty or have excessive, like peeing a lot?
No.
Okay.
In fact, I can hold it all day.
Okay. And then, do you struggle with anxiety or depression?
I have been seen for anxiety, but
Okay.
all of that's better.
Okay. No thoughts of harming yourself or others?
No.
Okay. Well, I think that concludes our health history. Do you have any questions or concerns?
I do not. Thank you.
All right. Thank you.